Hey, I'd like to welcome you to another episode of Mission Matters. My name is Adam Torres, and if you'd like to apply to be a guest on the show, just head on over to missionmatters.com and click on Be Our Guest to apply. All right, so I have Jason Kart on the line, and he's owner and a physical therapist at Core Physical Therapy. Jason, welcome to the show.
Thank you, Adam.
All right, Jason. So I'm excited to get into today's topic. So really talking about how to improve the quality of physical therapy. And for the listeners that have been watching this show for a long time, this is going to be a really interesting one because it's possible that maybe you had some assumptions or you had some thoughts about the way that physical therapy worked or just treatment in general that are going to be kind of debunked today. There's going to be some myths broken today. So I'm excited to get into this. But Jason, we'll start this episode the way that we start them all with our Mission Matters Minute. So Jason, we at Mission Matters, we amplify stories for entrepreneurs, executives, and experts. That's our mission. Jason, what mission matters to you?
Well, I'm out here trying to improve the quality of physical therapy care. I think we leave a lot on the table in terms of what we can give to our patients in order to get them to their goals. I feel that over the past couple of years, there's been a real transition to what's marketable, but what's not really getting the patient to where they need to be. So I started Core Physical Therapy to give my therapists and my patients the time and effort that they need in order to make their functional goals happen. And so far, after 9 years, we are doing that by finding ways to cut our overhead, to be able to give that time back to the patient for patient care.
It's awesome. Love bringing mission-based individuals on the show to share why they do what they do and like what gets them motivated to go out there and really just make a difference in the marketplace. So excited to have you on. And I guess before we go, too far into practice, tell us a little bit more about how this got started. So how did you get started really on this journey as an entrepreneur and also as a physical therapist?
Well, I started my career as a physical therapist. I did my undergrad at Syracuse University, got my doctorate at Mass General Hospital Institute of Health Professions in Boston. I spent a little time at Harvard Sports Medicine, and then transitioning to Chicago, where I worked for some of the big box companies. Yeah. And as I was progressing in my career there, I became a little bit disillusioned. I was working for a company that really push the amount of visits patients needed to be coming in. And I wasn't meeting those metrics. I'll be honest, I was let go from that position. I readily tell that to people because I felt that it was wrong. So I'd spoken to my grandmother in 2012, and she said, "Hey, listen, if you're really, serious about this, I'll be leaving you a little bit of money, not a lot, for some TheraBands and then maybe a couple months rent. Why don't you take a stab at it?" And I've just found a way to kind of minimize my overhead and be able to reduce the amount of work or ancillary work to the actual patient care. And here we are 9 years later with 3 locations, actually now 4 in the Chicagoland area, and we're doing great actually.
Man, what an amazing story. And I want to stick on this this kind of transition point that you had, because that was a big deal. Like that's jumping off the cliff, the ledge, like lots of however we want to characterize this, but lots of entrepreneurs and executives watch this and they can relate. So when it came time to kind of make that transition, obviously grandma helped a little bit, but like just that's a scary time period. Like what's one of the things that you would say to maybe some people out there that are maybe facing or considering launching a business? Obviously, benefits of hindsight, right? You're a decade in now into your business, but like if you can remember back then what it was like what are some things that you would say?
It never goes to plan. You write everything down. You say, I'm going to do it this way. I have these ideas, and I'm going to open the doors, and the patients are going to flood in. Not quite. It was a pretty rough. It was a pretty rough couple first months. I mean, you're literally turning off your paychecks, and the engine in the proverbial plane is now off, and you're gliding. and you're just hoping that you can get enough gas in the engine before it hits the ground. So you have to prepare for that. You white knuckle it a little bit in the beginning. So you really have to be flexible. You have to be prepared to put in a bunch of hours in order to make those things happen. But above all, you need to be hungry. Especially in healthcare, we're not business oriented people. We're used to patients just kind of coming to us, and we take care of them. But when you're hanging out your shingle and nobody quite knows that you're there, you really have to be prepared to hustle. It's definitely a change in mindset, and definitely a change in lifestyle. And it takes a little bit to get there, but it's a great time to grow and learn.
Yeah, that's I smile and I'm laughing, not at you, at myself, because I'm thinking about it like, yeah, everybody goes through that at times. I'm like, when I started I'm probably 20 businesses in before I finally landed on my calling and mission matters and what we do. But if you would have told me when I was, graduating college, I'm going to be a podcaster, I'm going to show, I don't even know if podcasts were around back then. Right. So things don't always go as planned, but sometimes that's where some of the magic happens, right? When you just you persist and you persevere and you just keep going.
Well, it's the pressure. The pressure, I think, really does motivate people to become creative. And as I was getting a little bit busier, all of a sudden I needed to find ways to be able to schedule patients. And this was around 2014, and people were like, hey, it's really hard for me to call you when you're working with people. So I started using online scheduling, and it's something we use today. And I will claim, without any major evidence other than my own research, but I started doing online scheduling way back in the day and just never stopped.
Wow.
So that's one of those things. I feel like I was on the cutting edge of it. I can't 100% claim that, but that was really a big turning point. All of a sudden, we made access a lot easier for people, and it really helped kind of bring people in the door on top of the great care that they were getting.
So let's go back to kind of just the concept. So you obviously, maybe the big box company you're working with maybe just didn't align with your value of patient care. So then you decide, okay, I'm going to try the entrepreneur route. There's a problem or there's an opportunity in the system that I believe I can, solve for the types of individuals that would want it. So now you go out and you're creating this concept. Tell us kind of some of the things that you had, this original vision that kind of carries through in your practice.
Well, some of the best patient treatments I had while I was working for some of the larger companies was when the clinic was slow. I was able to take my time. I was able to really put more thought into what we were doing with patients. And not only that, but also able to answer their questions in a meaningful way versus trying to just do enough to satisfy the patient, but then transition to whatever, my next patient that was coming in. So I really wanted to take that particular experience and replicate it. And it's difficult to do because while we are selling physical therapy, but really what we're selling is time and the effort behind it, more so than the exercises. And I wanted to be able to find ways that we could replicate that excellent patient experience every single time. And so far we've done that. So that was really kind of what I wanted to do. And that was my big goal, was to take that experience and just make it every day.
And so when we talk about the idea of improving the physical therapy experience, and this isn't to, we have to have a starting point in this conversation. And this isn't to obviously say, anything bad about any other physical therapist or anything like that. Not saying you said that, but what do you think are some of the challenges? And I'd like to kind of juxtapose this. So what do you think are some of the challenges of the current model, just overall?
I think the industry as a whole, I think, whether it's the clinic that's pushing it or the marketing or the tools or the education, it's really about getting more patients in the door. And that's where a lot of our reimbursements come from, because it's a fee for service industry. I think that it takes away from the actual value from each visit, because it's okay to have a certain tool, a certain treatment to do, but how does this fit into the actual framework of healing? And I feel like we're starting to potentially substitute treatment techniques for the actual time and critical analysis that goes into getting somebody better. There's tons of treatment techniques that are out there that are amazing, and all of them are good.
Yeah.
But where they fit in is really where this matters. I do dry needling, for example, and I think it's phenomenal. But it's not the only thing that I do. That fits into my framework. I wouldn't use that as a primary treatment for all patients. That has to fit in somewhere. And I feel like we lean on that just a little bit too much.
Hmm. And so taking it maybe one step further, and I know this is, and I'm not asking you to prescribe or anything like that on this, because obviously every single patient's going to be different. There's I don't want to oversimplify this, but maybe can you give an example? And I don't mean of a treatment, but I mean like a number. So if you're seeing a patient, just for people that have maybe don't have as much background working with the physical therapist. So in a normal practice or a traditional practice, I'll say, where somebody spends a little bit less time with the patient, like what does that visit look like maybe compared to a more in-depth visit?
Well,
Or what can it look like, I should say?
Well, what it can look like is, the patient comes in and, maybe they're put on an exercise bike or a treadmill for 10 minutes.
Yeah.
From there, they may see their physical therapist for, 10, maybe 15 minutes,
Mm-hmm.
to kind of talk about some of their symptoms, get some manual treatments, whatever that may entail for that particular therapist skill set. And then there's a soft handoff to a rehabilitation aid or what we call exercise specialist. But really that skilled work is that time that you're spending actually with the physical therapist, because
Mm,
that's where the magic comes from.
yeah.
So that's typically what it looks like, I would say, if I had to just give you a generalized view.
Mm-hmm. And so the opportunity here, when we're talking about like prescribing and just in general, like where's the opportunity in that model? Like how can that be improved?
Well, when you walk into a door to a physical therapy clinic, you don't necessarily know what you're going to get, and you actually don't even know what it costs.
Yeah.
So every clinic's model is a little bit different. So if you walk into clinic A or B, you don't know what you're really getting for the money that you're going to be spending, and you don't necessarily know what the insurance company or the reimbursement rates are going to be.
Mm-hmm.
So the model or the tact I took with this was to I guarantee patients. I guarantee you, when you come in, you're going to have a full hour with your physical therapist for your initial evaluation. That's going
Wow.
to be taking a good subjective, finding a good proper diagnosis,
Mm-hmm.
most importantly, educating the patients and giving them the science behind and why they're experiencing their symptoms. And then also initiating treatment and getting their plan of care and home exercise program together. So I have said out of the gates, that's what you're going to be getting through your first visit. And then every subsequent visit, we guarantee that you're going to be spending at minimum 30 minutes with your physical therapist one-on-one. We don't double book. We don't see multiple patients at the same time, because it becomes a distraction. And if you're really trying to get that deeper look or doing that critical analysis, you can't do that in 5-10 minutes with patients all over the place and everybody asking you questions. So that's the guarantee that I've made for people, so they know what they're going to get when they walk in the door.
And so it seems like, and not nothing against the assistant and everybody else, but you're getting more of the main analysis from the physical therapist. You're getting more face time, you're getting more minutes, you're getting more attention there. I mean, that's a big deal.
Well, if the volumized model is seeing patients, one-on-one for 10 minutes or 15 minutes, and they're telling them to come in 3 times a week, versus coming to see us and you're guaranteed at least 30 minutes. And I do give my therapists the leeway to add time if they need to for the more complex cases, but let's just say 30 minutes, and I'm seeing them twice a week. You have 45 minutes of actual skill time 3 times a week versus an hour seeing us twice a week. And that's where value should be being built, is that time with your physical therapist.
And I do want to circle back to something that you mentioned earlier, and that is different treatment types and being able to, that the more time that you're spending with somebody, the physical therapist is spending with somebody, like the more opportunity to uncover things, the more opportunity to really go deeper in terms of the diagnosis, and also I guess keeping track of the progress as the patient is getting better. Can you maybe just dig a little bit deeper and elaborate on that concept a little bit more? Because I know when we first talked and you were mentioning it to me, that was new to me. So I feel like it's probably new to a lot of the audience that'll be watching.
There definitely seems to be a muscle bias and a lot of
Mm.
muscle blaming, because when you think of physical therapy, when you think of physical activity,
Mhm.
muscles are, dominate the conversation. They dominate social media. Here's a tick face or insta talk or whatever we're using this week's
Yeah.
video, 5 best exercises to strengthen your hip muscles. And
Mhm.
it's fine, the exercises are fine, but it's making a lot of assumptions. It's making
Mm.
assumptions that the muscle is the problem, but never really asking the question, why is the muscle the problem? Because
Mhm.
muscles just don't go kablooey. There's got to be a reason for that weakness. And we can say disuse.
Mhm.
All right, but the patient's been running 3 times a week for the past 5 years. There's no big changes. Why all of a sudden the change?
Yeah.
So what was that caused? Everybody else in the world conditions. What was the change? So you
Mhm.
can say your muscles are weak, and that's not technically wrong, but it's being able to go that further step and say, well, what's contributing to that glute muscle weakness?
Mhm.
And that's important because the exercises themselves, like I said, aren't bad,
Mhm.
but they're misplaced. They don't answer the full question. And that's often where the conversation stops, whether because I don't have enough time to explain it to the patient, or they don't have
Mhm.
the time to explain it, or it gets a little too sinusy, or that soundbite doesn't fit into a minute video.
Yeah.
I've done videos in the past where I'm explaining this. I get no hits whatsoever. Nobody likes my stuff because it's not,
It's not
it's a
clickable
little more,
enough. I get it.
it's more complicated. There's a
Yeah.
lot more science to it, and it's generally not majorly actionable by the patient. So
Mhm.
why would they want it? It's
Mhm.
when I get to sit down and explain to you, hey, your glutes are weak because that little bit of back pain that you're having is affecting that nerve that hooks into that particular muscle.
Yeah.
If the nerve is being antagonized, you're not getting enough signal to it. We need to treat your back,
Mhm.
because that's where the problem is. Muscles just don't go quiet. And if they do, there's usually a reason behind it. And you would have
Mhm.
told me that reason. I fell down. There's some associated trauma, but people aren't telling me that. So this is
Mhm.
smaller and has to be put into a better context to actually get to the answer, to get a full and comprehensive answer for their problems.
And so what's so interesting to me about this is that it just seems like there's just a lot more opportunity. So I mean, for the patient to recover, to get stronger, to strengthen, of course, but there's just so much opportunity there. Because maybe a concept for some is that you go to physical therapists, you get back to a certain level and that's it. But it sounds to me like if you can get further and further to that root cause, like you're really able to affect, in some cases, of course, like really long-term change.
I mean, that's really it. One of my favorite patient types, and it's unfortunate for them, but
Mhm.
they've had physical therapy before. They've been dealing with a particular problem, 2 or 3 times, and they just haven't really gotten to it. They really haven't gotten to the crux of it. Um, and when I start talking about, if it's their knee pain, and their previous therapist said, hey, you have glute muscle weakness, and they've done things to the knee, they've done things to the glute muscles,
Mhm.
the patient gets better as a function of just decreasing their activities, which allows them to heal, but they're going back into their activities. But
Mhm.
once we start talking about inhibition of muscles due to a spinal problem,
Mhm.
or reflex inhibition from a joint, or looking at the mechanics, the body is too complex for there to be simple answers for things. The simplest answers are the traumatic ones. I fell down and I broke this. Okay, that
Mhm.
makes sense. But if something just starts to gradually go, or has a trigger that doesn't really make sense, you have to get into the weeds. You have to have the time to sit down and critically analyze what's going on with this person and ask the right questions so you can answer
Mhm.
them. And that's really the opportunity, is being able to take that time and go through all of this to really show the patient, here's the value. This is how we're interpreting your symptoms. Here's all the evidence for it. The
Mhm.
things you're doing weren't bad, but it just didn't get there. And the reason why it didn't get there is they didn't take it back far enough to be
Mhm.
able to get to where that root cause was.
Yeah, that's interesting, and that's why I bring that up, by the way, because I feel like there's going to be people watching this, and there will be that, well, I went to, it didn't work for me, maybe something else, or they didn't have the best experience. But and again, not saying anything against any other physical therapists. I feel like people that work with people in this profession, and many in the medical field, like their core is that they want to help people,
Oh,
but not
absolutely.
ev- but it does, but that also doesn't, on the other side of things, say that all practices, all procedures, all methods, and all systems are created equal. Like to me, the common sense of it is, if I want more time with the physical therapist, okay, well, I should probably be going to a model that does allow for that, versus understanding just the volumized model of trading your time for dollars, and what that looks like in either a big box or just another office, whatever it is. Like there's a potential trade-off there. And I think that's kind of the paradox, if you will, huh?
Yeah, I mean, it is a fee-for-service industry. So the
Mhm.
more a patient comes in, obviously the more money we make. And
Sure.
it's not that anybody is looking for the patient to not get better. I mean, some patients
Yeah.
are more complicated.
Mhm.
Some patients require more management. I mean, that's just, there's no two cases that are alike. It's when things get missed, and it's,
Mhm.
I don't want to blame. I mean, I don't blame the therapist. I don't even
Yeah.
sometimes blame the business model. But things have a tendency to be put in a box,
Mm.
even from school. Like when we learned orthopedics, you learn joint mechanics, you learn the orthopedic side, you learn the neurological side. So it's very compartmentalized sometimes.
Mhm.
And as you get out of physical therapy school, and what needs to happen is learning that framework. How does
Mhm.
this all work from point A to point B? The problem becomes, and I would say this is more of a marketing thing
Yeah.
because it's looking for volume, is you'll learn this type of treatment technique or that type of treatment technique. And whatever that ends up being, it kind of gets put into that primary category that you learn this technique. So then every patient, or there's a lot of patients that need it. And I'm not saying the technique is bad,
Yeah.
but is it misplaced within that framework? If we're doing instrument assisted soft tissue work, for example, because the muscles are tight, well, why? Why are they tight? Why is that right hamstring always tight? That's the problem, because if we're
Mm.
just going to the muscle, we're not answering the question of how it got there, because that's really the problem.
Mm.
That's where you can continue to do it. The bias of tradition, the patient
Mhm.
says, okay, yeah, it takes time, and physical therapy does take time.
Yeah.
And the therapist is doing the work, because again, these are not changes that happen overnight. But after a month or two and the patient isn't progressing, this
Mhm.
is where we need that time and that critical analysis to
Mm.
really say, well, what's going on here? And it costs the patients time, effort, and money. And I feel that we owe it to them as a profession to
Mm.
give them that, by finding ways to be able to take those deeper looks.
You mentioned earlier something about like a muscle bias, and let's just say these 1 minute sound bites on social media and otherwise. So I have to ask the obvious question, like self-treatment versus going the physical therapist route. And I don't even know if self-treatment is a real word, honestly, or if that even is in the same
Sure.
category. But
Self-care
really,
techniques in the biz.
yeah, it's really though the benefits though, right? Like the benefits of working with a physical therapist for long-term results and to get to the root of the problem. Can you talk a little bit more about that versus trying to self-treat or self-diagnose by watching YouTube videos and otherwise? Because for those that watch this that have never worked with a physical therapist, maybe talk a little bit about that.
Um, I love it when patients are proactive, because they are the biggest part of it. And in a lot of cases, the patient really is the wild card. So the patients that are involved and want to be involved in their care do the best. Our job is to point them in the right direction. So in the beginning, with a lack of a knowledge base, on the patient side, it is easy to get drawn into, I want to say, the muscle bias or muscle blaming, where, oh, these muscles are weak or these muscles are tight, I need to do something to said muscle.
Mhm.
And that makes sense to the patient, because most of us are or most of us have some experience with muscles. We've been tight, we've been sore. 24, 36 hours later, you're better.
Mhm.
But what happens when that doesn't come around? when you're not getting that improvement. And that's where physical therapy comes in. The Instagram, the TikTok videos are good. And I'll be perfectly, I steal exercises from them all the time. I'm not that terribly creative because they are good exercises, but my job is really finding what's that root cause. And that's where, if patients are getting past a week, 2 weeks of symptoms where they're just not progressing or they're plateaued, that's the stuff that needs to get looked at. We feel better when we do things. And it's very interesting because even though we may not be aiming in the right area, patients have a tendency to feel better if they're being proactive versus doing nothing. But at a certain point, you need to pull back on the reins a little bit and say, okay, let's kind of take a minute here and figure out, am I getting better? Is this working for me? Am I progressing meaningfully? And if not, that's where you need those skilled eyes. That's where you need, somebody to kind of take that look for you and kind of just connect the dots as to how you got here and how we're going to get you out of it. And that's the hallmark of good physical therapy. The exercises are just getting you from point A to point B in terms of conditioning and rehabilitation, but I wouldn't say they're curative. The curative part is finding out what's picking at the proverbial scab so you can heal. And that's the important part.
Awesome. How does insurance play into this? Like insurance reimbursements, like how does that play into the equation of working with a physical therapist?
Insurance companies are like the bane of my existence. It's
said most medical professionals.
Yes, I know I'm not alone on this one. Cost of care is expensive, and it tends to be this self-fulfilling prophecy. In order to bill insurance companies, your overhead and everything goes up, which then necessitates getting more patients, which waters down the care, which means more treatments, which means decreasing value, which means decreasing reimbursements. And I can get that loop going on and on and on. So feel free to just keep that going for another 2 or 3 minutes. It's unfortunate when insurance dictates terms about how often a patient can be seen. Some of their practices are questionable. I've had patients that have crazy high deductibles, but also have like authorizations, which means I have to submit this stack of paperwork to ask for visits from an insurance company, which probably isn't paying me all that much, but they aren't paying anything. And I had this happen to me before. I had a patient with a ridiculously high deductible, and I put in for some visits. She actually was getting better for the first time, and I was about the 3rd or 4th therapist that she's seen. We did 6 visits. I asked the insurance company for more, and they said no, which is crazy because they weren't even paying. They're not even contributing to the patient's care. She's still smack dab in her deductible and would be forever.
Wow.
That's a problem. You know what I mean? So then what do you do? And she found the value and she paid a cash rate, which was great. So, I mean, insurance reimbursements, a lot of them pay us not a whole lot. Actually, personal trainers make more per hour in some cases than we do, which is unfortunate. I think we as an industry take a little bit of blame on that one, because if we're prioritizing volume, then you're decreasing value. You do that long enough, and then the insurance companies say, well, we're just not where we need to be. So I feel like we take some of that. I also feel, though, insurance companies don't often take into account our costs in providing some of those, providing these services. It's like the big 800-pound gorilla in the room that just, it can be tough. I would rather negotiate one-on-one with the patient to get a proper price to get them to where they need to be, and they see the value. But we're muzzled by their regulations. We're muzzled by, we can't even advertise our prices. So yeah, I mean, it's really a tough scenario with insurances. When it works, it's great, but it's complicated and it just adds to our overhead, and then this never-ending cycle continues.
So Jason, first off, it's been awesome having you on the show today and learning more about your background as an entrepreneur, of course, but then really what's going on in the physical therapy industry, the improvements that you're making through core physical therapy. So I just have to ask, what's next? I mean, what's next for you? What's next for your practice? I mean, 10 years in, congrats. That's a big deal. What's next?
Well, we're going to continue to grow organically. We've had 3 clinics now for a while. We're actually starting a fourth, maybe a fifth coming up sometime this year. But what I really want to do is just kind of win back physical therapy and just really put back that value into it and make it less about just the exercises and the stretches, but more about that critical thinking. I'm currently in the process of developing a program for all my therapists to help them learn and grow their practice, to learn more so we can continue to give these valuable treatments to patients to really make their goals happen. We're going to continue to do our grassroots marketing. We don't spend a ton of money on going out there and marketing with, on Wrigley Field or anything like that, because then it would necessitate volume. We just want people to get better, however many visits that takes, and write us a good review. Tell your friends. That's how we grow this thing, because then we can keep that value in the visits, instead of having to chase the bottom line, which is what we don't want. But I'm hoping to just continue to grow the practice, grow into a couple more locations. We're in a very, I'd say Chicago is the home of corporate physical therapy, and right now we're doing quite well. I'm going to continue to push that forward. So yeah, we're always on the lookout for the next big thing, and I'm always looking for the next challenge.
Amazing. So if somebody's watching this and they want to learn more, to connect and follow your journey and connect with your team, I mean, what's the best way for them to do that?
Well, you can definitely take a look at our website, which is coreptclinics.com, which has all of our information, how to get scheduled, more about our practice. You can also follow us on Instagram at Core PT Clinics Chicago. And you can also find more about me personally at jasonthept.com, or on Instagram, jason.the.pt.
Perfect. And for everybody watching this, we'll put all of this into the show notes so that you can just head right on over by clicking on the link. So don't worry about all of that. But again, it'll be in the show notes. And Jason, again, awesome having you on the show. It's been a pleasure getting to know more about you and what you're up to. And to the audience, as always, thank you for tuning in. If this is your first time with Mission Matters in the platform, just to let you know, we're all about bringing on entrepreneurs and executives and experts, people that have a mission to share. We bring them on and we provide that platform for them to get their message out and really just to make a difference. If that is a content type that you're into, then we definitely welcome you to hit that subscribe button, because we have many more mission-based individuals scheduled to come up next, and we don't want you to miss a thing. And Jason, wishing you much more success and congrats again on the 10-year.
Thank you, Adam. Appreciate it.